My name is Zach Adams. I'm a psychologist. I'm on the faculty at the Indiana University School of Medicine in the Department of Psychiatry there. I'm also part of the Adolescent Dual Diagnosis Treatment Program through Riley Hospital for Children. Stress is a normal part of life. All of us experience stress. From time to time, those sort of feelings of distress, upset feelings, and so on can become overwhelming. And they can persist over time in ways that can interfere with our ability to do things that we need or want to do in our lives. For some people, when they feel upset, worried, sad, they might use opioids or other substances to help them feel more normal, to calm down. Maybe it's that they're intentionally using with the purpose of trying to manage or cope with distress. There's lots of different ways that, having those stressors might lead to more use. But for many people, having stress in their lives is a trigger for use. In the long term, what we see is that when folks start doing that, especially during their teenage years, they're at a much greater likelihood of developing problems with substance use as they get older. It's actually pretty common during the teenage years, especially for anxiety and depression to crop up maybe for the first time, which can be scary. It can be upsetting for some people. Some of the symptoms of depression and anxiety look a lot like kind of what we experience when we're stressed in the moment. Maybe it's difficult to think clearly or to take our mind off the thing that's really stressful. Sometimes we feel like we don't want to do anything at all. We might feel more or less hungry. We might sleep a lot more or sleep a lot less. And sometimes it's not just that we feel sad or withdrawn, but we might actually feel more irritable and hostile toward other people in our lives. If folks are noticing that, whether it's in themselves or in somebody that they care about, that's a good time, especially if it's lasted not just for a day or two, but over the course of at least a couple of weeks. Those are good times not only to check in and say, how are you doing? How can I be helpful? But also maybe to talk to your doctor, talk to a counselor, talk to somebody that you trust and care a lot about. To see if there's something that can be done to help you manage what you're experiencing. Sometimes when people are experiencing anxiety, depression, other mental health concerns, not only can it feel isolating, but it can also be intimidating to reach out for help. Sometimes people think, I should be able to handle this myself. Sometimes people think that others will look down on them or think less of them or think that it's a weakness of some kind that they're maybe experiencing the types of symptoms that come along with depression and anxiety. And although it can feel like you're alone or feel like that's something that you have to hide or keep from other people, chances are there are people in your life who are important to you, who you look up to, who you trust, who've struggled with similar things themselves. And, one of the best things we can do is to reach out for help when we need it and to offer support when we can, because that's one of the best ways to get through really stressful events is by leaning on our supports and staying connected. At the end of the day, one of the things that's really important to remember is that most of us at some point in our life are going to experience, whether it's symptoms of depression or anxiety or just being really stressed out and overwhelmed to a point where we need some help and we need some extra help beyond what we're able to do ourselves. And there's no shame in reaching out for help, especially if that's what it takes to get us back on our feet to move forward.